The difference between getting off drugs and staying off drugs, a wise man once told us, is the difference between a wedding and a happy marriage. The wedding is a big deal, but it has nothing to do with a happy marriage. Walter Ling, professor of psychiatry and founding director of the Integrate. Right now, our entire treatment system is targeted to the wedding. Ling's research, and the work of many others, has shown the effectiveness of medications in battling drug addiction. California has been prodding its 1-800 licensed treatment facilities to embrace these medications for years, drugs that bind to the brain's opioid receptors and foil opioid highs, helping people manage cravings, prevent overdoses and, generally, pave the way for a happy marriage. But a tremendous chunk of treatment facilities in California, -41%, resist. They didn't provide any pharmacotherapy services for their patients at all, despite skyrocketing overdose and death rates, according to data compiled by the Substance Abuse and Mental Health Services Administration. Just 22% of California's outpatient facilities, where most treatment happens, offered methadone, buprenorphine or naltrexone treatment. These are the gold standards for managing opioid addiction. And only 59% of programs transitioning people back to their regular lives offered overdose education and naloxone, a drug that can reverse opioid overdose and practically bring people back from the dead. It's a vestige of the abstinence-only, don't replace one drug with another philosophy that drives so many 12-step-centric programs in the state, particularly in Orange County, ground zero for California's treatment industry, and it's an outrage. And are now researchers from the Pew Charitable Trust Substance Use Prevention and Treatment Initiative, pushing states like California to adopt very specific data tracking that can illuminate what works and what doesn't, and save lives. California and many states have public-facing dashboards tracking overdose deaths, emergency room visits, hospitalizations and opioid prescriptions. But far too few track a full range of metrics, including how many people are diagnosed with opioid use disorder, the number of providers available to treat them, use of FDA-approved medications or treatment retention and outcomes, Pew said. You can't manage what you can't measure, the old saying goes, but officials can't agree on what should be measured. So Pew convened its own panel of experts, and it settled on key measurements in the life cycle of a chronic disease, cascading from initial diagnosis to final outcome. This approach has been used worldwide to manage hepatitis C, HIV, diabetes and other chronic diseases, and it can be used here, they said. What should be tracked? Try the percentage of people with documented diagnoses,